We are here to discuss the most deadly and devastating public health and public safety epidemic that is facing our state. California is now losing over 10,000 people to overdose annually. That's a number that has doubled in the last 5 years. That increase is attributable largely to fentanyl. This is a drug that can kill a person with a very small amount. It is impacting every city and county in our state. I come from a city where we are now losing 2 people a day to this drug, over 700 overdoses in San Francisco a year. But it's not an urban issue. It's not a rural issue. It's not a suburban issue. This is an issue that is affecting all of the communities that we represent. It doesn't know partisan lines. It doesn't know age. We are now losing twice as many children to overdose than we were just 2 years ago. We have to come together with solutions and with leadership at the scale to match this epidemic. Similar to the way the state came forward when we were faced with COVID, when we were faced with the HIV/AIDS epidemic, we need bold and determined leadership. I want to be clear on a few things as we get started. This is both a public health and a public safety issue. If somebody is selling a pill that is laced with a drug that kills a child, that's a public safety issue. And we need to put a stop to that, and we need to put a stop to the ways that people are able to use social media and other vehicles to sell drugs in that way. It's also a public health issue. We have people who are addicted to a drug that is many times stronger than heroin, that has such strong physiological impacts on their body that they know nothing except how to get more of that drug. People who are in that situation, they need help, they need treatment, and they need care. Right now, we have over 90% of people who are addicted to opioid not enrolled in medication-assisted treatment or other forms of treatment that can get them off of those drugs and into recovery fully. That's unacceptable, and that's something that we need to confront. This is also an issue that both requires us to address addiction and also requires us to address poisoning. We have people, as I've said, and we're going to talk a lot about this, about how we can get them into treatment. And we need to focus on that. But we also need to focus on the fact that there are some people, because of the way that this drug operates and how small of an amount can kill somebody, we also have to make sure that people are aware of those risks, that they're educated, that we address prevention, and we make sure that we take every possible action we can to save lives.